Hello class and welcome back to Anatomy Unplugged. This is the final week in our curriculum, so the last lecture. Started to get a little creative with my art there. Hopefully you enjoy that. This lecture is a little different because teeth and upper airway is not really covered in most medical curriculums. It really falls in the world of dental specialties. So many of the students taking this class are either going to be going to PA, therapy, MD, RN school. Don't really cover this. However, unfortunately, we need to know it. It's part of the body and it's commonly misunderstood. So we are going to go over a few key terms here to try and increase your retention and knowledge of this area that is commonly skipped in most medical curricula. So let's start with the nose, the conchae or conch, resembling a conch shell or a conch shell. They are kind of weird. There's these little shelf-looking things in your nose that warm and filter and humidify the air. Main function of this really is to increase the surface area. This is kind of gross, but it helps improve the odorants that we sample. Recall from the prior lecture, odoriferous molecules dissolve in the mucus in our nose, and that's how we smell things. It is kind of gross. Another slightly gross fact, many of you know that, but the nasolacrimal duct floods the nasal cavities. That's why you get a runny nose when you are crying, because it's the drainage pathway represented right there, so that's kind of neat. Just to maybe partially kind of gross you out, this is a nice drawing that someone drew of rhinitis, and not only does the tears go down your nose this way when you're crying, but if you get a cold and you have inflammation, it can go backwards. And yeah, why did they choose green for this drawing? I don't know, but that is what postnasal drip is. It goes right down your nasopharynx into your oropharynx and make you cough. And yeah, that is pretty disgusting. Another thing that we went through during COVID, oh man, I had so many swabs working in the medical world here getting tested for COVID. When you're aiming, you certainly don't want to puncture these turbinates, but you want to get at that area because that's where all those molecules are coming in and being trapped by the turbinates. So if you're trying to capture some COVID molecules, you want to get that swab in there. There are two pathways you can go for, represented by the drawing here in the arrow. One, you can hit the middle turbinate right there, or two, if you really want to go for the gold, you go straight back to the back of the nasopharynx. That was the first time I had that done. They thought they had to go as deep as possible, and man, that is uncomfortable. More of the modern ones, especially with flu testing and things like that, they tend to hit the terminates themselves. Now, again, more pictures that kind of keep you a little bit creeped out. This is what it looks like when you get a lot of swelling and enlargement of your turbinates or chronic sinusitis and rhinitis. Quick, easy way to remember them. There's three: superior, middle, and inferior, and they differ in terms of their size and position. Superior is the smallest, all the way on top, represented right there. Drains your sphenoid and your posterior ethmoid sinus. Not something that we talked about a lot in lecture. The middle is middle in size and drains all the sinuses that people associate with getting a sinus infection or having sinus pain. Your maxillary, your frontal sinus, and the anterior ethmoids. And then the inferior one, that's the big one, which can certainly get swollen right there. That one actually drains the nasolacrimal duct. So many people think of these turbinates as shelves that are pulling in, absorbing, and providing more surface area for those odoriferous molecules and antigens that are out there. Also help direct the airflow and help track your mucus well. And then the meatises, not meati, but meatises, the holes, so to speak, those are, again, disgusting catch basins for all that sinus drainage. When you get a sinus infection and these cavities fill up with the junk, it's got to be drained somewhere, and they exit out the meatises through the turbinates. So one more, why are all these pictures so gross appearing? That's what it looks like when you get sinus infections and chronic sinusitis, just all that junk and, well, pus basically collecting your sinuses. This is why during the day when you have a sinus infection, maybe you don't feel as much, but as soon as you lie down at night and, well, gravity kicks in, all the sinus junk that collected in the bottom of the sinuses start to track backwards, go through the meatises, and then you get all that coughing and postnasal drip action at night. Okay, onto the auditory tube, more commonly known as the Eustachian tube. This is your pathway to equalize the pressure in your middle ear. Some people think of the PEM, I don't know if PEM works for you, but pharynx to the ear for the middle ear. Pathway to equalize the middle ear, PEM. Those kind of work as a way of remembering this. It is subject to infection if you have an upper respiratory tract infection, a URI, and those bugs travel along the epithelium. They can go right up your Eustachian tube and right into your middle ear, and you can get otitis media. Fun fact on this one, we do have a tiny muscle in our face called the tensor veli palatini. And it does come from the third branch of cranial nerve 5, and that's what causes the opening and closing. Again, we're going to continue on the creeping you out kind of pictures. There is a tunnel or tube here that basically connects your jaw and your mouth to your ear, and that is the Eustachian tube right there. And there is a pathway that goes all the way from one to another. And yes, your trigeminal nerve, which is largely considered a sensory nerve, that V3 branch does have motor function of that tiny little tensor veli palatini, which has this interesting kind of pulley action around the pterygoid right here. And it causes that normally collapsed and closed Eustachian tube to open right up. Okay, on to swallowing. There's a lot of things that happen with swallowing that we don't really cover often in medical curricula. This mnemonic is much easier because we all must eat pie. It starts in the mouth, goes to the uvula, that's a nice way to fit in the mnemonic here, to the soft palate, tongue, epiglottis, your arytenoids or arytenoids, some people pronounce them differently, and then finally down to the trachea and into the esophagus. So, right, we must eat pie. The arytenoids or arytenoids are these little crisscross muscles right there. This is a great way to review your cranial nerves. 5, 7, 9, 10, and 12. They all interact and coordinate to facilitate a nice normal swallow. And again, if we're going to creep everyone out here, this is called a video fluoroscopic swallow study, or VFSS, often used barium, and it's just a live real-time x-ray of someone swallowing, and you can see how even after the swallow he's kind of chewing on things. We all do that. This is where we want the pathway to go through, right down through the esophagus. We don't want it to go forward into the trachea as represented here. There's another example of it. It just looks so weird. Food should go into the esophagus posteriorly, not there into the trachea anteriorly. This is an example right here, fortunately not a GIF because that would be kind of creepy, of barium that unfortunately can go through, and you aspirate the liquid and it goes right into your lungs. That's a big problem. Okay, on to a PSA here. We're going to wrap this video up here. We never talk about the teeth in medical curriculum, but you should know it. I really want more of our medical providers in our world here to know more about oral health here. Gingivitis is gum disease. If it gets worse and worse and worse, it becomes periodontitis. It's all in the spectrum of periodontal disease. The gingiva, represented up here, get all inflamed when we don't have good care of our teeth, and plaque can build up. This is a big problem because if it erodes that area where the teeth are setting or resting in our mouth, your tooth is going to come out, and that is generally not a good thing, and it is so preventable. 100% poor oral hygiene leads straight to gingivitis and then periodontitis and then loss of your tooth. Basically, if you don't brush your teeth, and if you combine that with eating a lot of sugary foods, this sticky kind of junk of sugar and bacteria form plaque, and it literally just sticks to the lower area of your teeth, right where it meets the gum line. That can harden into something that literally needs to be scraped, or sometimes some dental tools, some kind of abrading type of tools. It forms into this hard tartar or calculus. And that is not easily removed. It can be a nidus or another source for bacteria to come hang out and have a party and then just basically destroy your gingiva and give you worsening gingivitis and periodontitis. Simple solution here, just brush your teeth, floss daily, and see your dental hygienist. Dentist is important, but your dental hygienist, having a good relationship with your dental hygienist is critical. Some insurance plans let you see your dental hygienist up to 4 times a year. In fact, I have my appointment next week, and it just keeps you on track. And of course, related to this, my second public service announcement here. What is a cavity? Well, it's literally a hole in your tooth. It's decay. Unfortunately, when you get these caries, it starts out at the top and works its way down through the 3 layers of your teeth. The hard outer layer is your enamel. Amazingly, it can get through that. Dentin is where we start to have nerve endings, and it is quite sensitive, and you're going to feel that. But the first step, you don't even feel because it's happening in your enamel. And then finally, gosh, if it gets deeper into the pulp, that 3rd layer, man, you're going to have a problem. There are 3 different types of cavities: the smooth kind, the pit and fissure kind, and then down into the roots. That's when people get the root canal. And again, very similar. Good oral hygiene, regular dental visits. I know fluoride right now in this current landscape of the recording of this video is somewhat of a political topic, but there is medical reason and rationale why people have used fluoride for that reason. So what is a root canal, right? This is horrible. I've had this done once. I never want to do it again, and I'm very avid oral care advocate, I guess is what I'm trying to say. When you get a cavity and when you get an infection that goes through the 3 layers and gets down into that 3rd root and pulp layer, it gets all the way down into the bottom of the tooth. And if you can get down there and literally drill all the way down to the root, clean that out, you can still preserve your tooth, and you don't have to get it ripped out of your mouth and lose a tooth. Basically, you drill right in, you clean out all that junk and all the bacteria. You often fill it with antibacterial fillings, clean out that canal and disinfect it. You top it with a filling and a crown. Sometimes you need a post as well, unfortunately, if it's just too much digging out and the area is unstable. It's just like if you have spinal surgery and you have too much bone removed, you got to get rods and screws put in there to stabilize your bone. Same thing in the teeth. If you drill out too much or there's just too much decay and there's none left, you have to put this post in there too to make sure that crown stays. So again, please don't neglect your teeth and take care of it. Take care of them, because otherwise you're stuck with root canals and potentially tooth extractions. And finally, as we've wrapped this up here, you know I would never leave a lecture without giving a few puns or dry dad jokes type of thing. And since this is our last lecture, we're going to have a couple of them. Some of you know that enamel is often considered the hardest substance in the human body. Yes, even harder than bone, but it's still vulnerable to all that acid and plaque and bacterial buildup, and that's how we get cavities. FYI, the physics here, just because a substance is harder, it doesn't necessarily account for its brittleness. So harder substances tend to have more brittleness, and if you check the brittleness factor in enamel, it is fairly brittle, so it is susceptible. So once again, take care of your teeth, right? Brush and floss. We only see the top 2/3 of our teeth. The rest of it is deep under there like an iceberg. And you'll notice that if you've ever had to get your tooth removed. Sorry for that graphic picture there, but all of that is hanging out under your teeth. And if you got to get that ripped out, man, that is going to hurt. So take care of your teeth. I'll get rid of that picture because it's kind of creepy. Saliva, right? This is why we chew gum if we can't brush our teeth. Your saliva does help neutralize some of that acid and wash away and clean some of the junk that's in our mouth, and does have some minerals that do protect the enamel. Calcium is one of them. So yes, if you cannot brush your teeth, the backup plan is gum. Another gross fact relating to saliva: the average person produces enough saliva in a lifetime to fill 2 swimming pools. How disgusting is that? But awesome for your oral health, right? Okay, last slide here. Brushing, right, only cleans, depending on the study and depending on the aggressiveness of the individual, only about 60% of your teeth. You gotta floss, and you probably should use mouthwash. So floss like a boss and take care of that. Unfortunately, most common chronic disease in children in terms of teeth is just cavities or tooth decay. So it starts early on in life, and it is even more common than typical things like allergies and hay fever and asthma. So please, if you have kids, please teach them the importance of oral health. I wish I could be a shark sometimes, because if you get a problem with your tooth, you can just grow another one. 20,000 teeth in their lifetime. We unfortunately only have 2 sets, and that's all we get. So again, take care of your teeth. Some people were paying attention to dental care way back in the 1400s. The first toothbrush used boar hairs, and thankfully now it's switched over to nylon. That's a picture of the first recorded known toothbrush in the 1400s. Pretty cool. That looks pretty painful though, but I guess that's what you do. There's no toothpaste back then, so you just shove it around your mouth. Now, some anthropologists and history buffs refute that and say, now, wait a minute, there was stuff before the 1400s, and you're absolutely correct. It was a chew stick, like what we give to our dogs, way back around 3000 BC. Apparently, that's the first known chew stick version of a toothbrush, where you just kind of chewed on something to help get some of the little pieces out. And lastly, your teeth are as unique as fingerprints. This is why, kind of scary, but sometimes identification of people comes from your dental records. Even identical twins do not have identical teeth. So thanks for hanging on till the end. Hope you enjoyed the class. And what I guess I would like to close with in terms of the teeth is, well, even if it's an area that we don't regularly treat, understanding the terrain of your mouth can help us in terms of taking care of patients, navigating referrals, recognizing red flags when they start happening in your patient, and at least in my opinion, appreciate the body's just incredible design. Good luck on the final, and I'll see you in the next video.